When you have a curettage and then a pregnancy
This is
occurs, does the possibility of more stretch marks increase than
There is
normal?
no clear proof and study for that, but there are studies indicating low birth weight babies
But there is no obstacle to
do
giving
not be
birth.
born come.
So, doctor, we decided on abdominoplasty. What should we do beforehand?
Contrary
Or
to
what
what
should
is
be
known,
done?
patients often break their diet, thinking they will get an abdominoplasty anyway. What is important for us is that they lose as much weight as they can.
We did
before
not lose
coming.
weight.
If they smoke, they should definitely quit smoking at least 1 month
For
before
wound
the
healing.
surgery.
Well, Professor, shall we talk a bit about the process, for our curious
In operation,
viewers?
with incision starting from the groin area, from both groin areas, all the skin is lifted up to below the chest, tightened, and then pulled down over the old cesarean section sites. Meanwhile, the belly button skin is repositioned, meaning it is relocated. Most importantly, all the muscles that have lost their function and thinned are repaired.
Yes.
Can you provide information about the recovery
If the recovery
process?
process does not involve a patient who is a chronic smoker, the patient can return to daily life in 15 to 20 days.
Length of hospital
We
stay.
keep the patient in the hospital for 2 or 3
We
days.
wanted the pain to
I
be
can say that pain is
compensated.
generally the most intense among plastic surgery operations. So it's beneficial for the patient to stay for 2 days.
What surgeries can be performed together with a
Generally,
tummy tuck?
liposuction of the back and waist area has become a part of abdominoplasty. That is, without it, the visual outcome is not very appealing. If liposuction of the back and waist area is not done, it is usually combined with breast augmentation or breast reduction.
Well, if she gains weight again, will there be a change in
Of
proportion?
course, if the patient gains weight, the skin will sag downward, leading to excessive thickening in the upper abdominal area, the region we call the area between the belly and the chest, since there is no skin left. The appearance becomes worse than before.
Thank you.
That's why the patient needs to pay attention to diet and exercise after surgery.
So I think I'm probably wrong, but I want to ask anyway. No, you can't do a tummy tuck every night. There needs to be either a serious case of flabbiness or loose, cracked skin, or if there is fat, liposuction is done, and then perhaps a tummy tuck is performed. But you also mentioned something like this. If these aren't present, if there's a deformation in the abdominal muscles due to pregnancy or another reason, what approach do we take in these cases? There might not be any skin to cut off, but the abdominal muscles are
Generally,
deformed.
if the abdominal muscles are deformed, meaning if a baby of that size was carried, there's also looseness in the skin on the abdomen.
How do you mean,
So if there is
teacher?
deformity in the abdominal muscles and they have become very loose, it also causes the skin to sag.
Okay, teacher, some time passes after these surgeries. 2 months, 3 months, 4 months. There's something very curious. I mean, will there be scars?
Of course,
Well,
my
I have a
son,
lot of
we are
scars.
everywhere there is surgery.
A trace is forming.
Is anything done during the transition
So in
process?
a year and a half, those scars change from a reddish color to white, close to skin
Do you
color.
practice?
But there will definitely be a mark.
Do you recommend anything
Fractional
as an
laser
application?
treatment can be done for discoloration. Scar-reducing creams can be used. But no matter what is done, there will definitely be a mark.
Isolation
Yes.
water?
Well, doctor, the patient came. What happened to the surgery? He was pleased with my last sentence. Either she went through a pregnancy or, for a completely different reason, returned to her original state. The man got the ashes, gave them. Can the surgery be done again?
Our revision surgery can be performed if the muscles have relaxed again and the skin has loosened.
So there's no specific number or anything, right?
You cannot
I mean,
do
it's a
it a large
repeatable
number
surgery.
of times. You cannot apply it to the skin repeatedly.
So are there any situations where you said we cannot perform this on certain people? Or who can or cannot have it
Contrary to
done?
popular belief, if the body mass index is suitable for obesity surgery, first patients should undergo obesity surgery, such as stomach reduction or stomach bypass, and lose all their weight before coming.
Then I
So
can
for every
recover.
patient, especially overweight patients, coming with a stomach is more risky than normal patients, both in terms of recovery and post-operative complications. Therefore,
Okay, teacher, you-
it is better if they lose weight
Well,
before
of the
coming.
clients who come to you for consultations, the most frequently requested is tummy tuck. Is there a percentage for tummy tucks?
Honestly, it is because the doctor is heard where he is successful.
kind of like
Usually
that.
come next to the thick one.
So our viewers are usually curious about this. Do they need to come with a fear? Is it something difficult? Could you provide general information about this? Is there anything to be afraid of? Or could they encounter any complications?
Like all surgeries, A tummy tuck has its complications. The important thing is to filter the potential complications before surgery, to operate on the patient in the least risky way. What are these? There is chronic obstructive pulmonary disease, there is chronic lung disease, there is smoking, there is alcohol, there is blood pressure, there is anticoagulant use. There are tendencies towards clot formation in the body. She always uses birth control. All of these are filtered and explained to the patient. It's better to approach surgery with an understanding of how much higher or closer to normal your risk is. So it's not a very simple surgery.
So after these tummy tuck surgeries, how long does it take to achieve the desired appearance?
If the patient is healthy, not a smoker, and not very old, they will recover in 1 month.
It reaches the desired knitting in 1 month. We specifically say this for tummy tuck surgeries. But when doing another tummy tuck, can this be done in another procedure, like an injection, meaning fat removal, in the same operation?
Liposuction can be
So
done.
we can do this
It
in the
has
same
already
procedure.
become a part of a tummy tuck. There are few who do a tummy tuck without doing liposuction on the back and waist area.
Well, how long after can someone actively involved in sports return to their social life and start exercising
For
again?
1.5 months.
After
It
1.5
lasts
months, I
1.5
mean, starts with
months.
walking, then
We
moves
already
to painful
recommend
sports.
exercising after a tummy tuck, because even if we have stitched the abdominal muscles, if the person does not exercise and use those muscles, they can become loose again, especially
Let
after
me
a tummy
send my
tuck.
room here.
Abdominal exercise is essential.
There is a concept related to nutrition
Of course,
and
they
diet.
will pay attention to their nutrition and diet. They will eat a diet rich in protein. We already support their diet, so they will try not to gain weight again.
Sir, in a situation where we are obliged, can Karengar may be done before Gemelik?
Now, such a situation can occur if every patient has undergone obesity surgery. Reduction has also happened. Gastric bypass has happened. Sometimes these patients can lose 60, 80, or even 100 kilograms. So it's a bit difficult for these patients to make themselves appealing to their spouse with those sagging skins. Therefore, before pregnancy, the patient's body can be tightened and shaped through a tummy tuck. There is no problem with these patients giving birth again.
Well, during this process, is there a need for psychological support? I mean, that adaptation period after the surgery, yes, maybe it's a look one desires more, but during that process, can something psychological happen? Are there any depressive episodes? I
So
wonder?
generally
Like,
for
what have you
tummy
done?
tuck surgery,
Regretful feelings, have you ever encountered such
If you do not combine the
situations?
tummy tuck surgery with many other procedures and perform it as a single tummy tuck surgery without adding things like arm or leg procedures, then the recovery period shortens. As patients get back on their feet within 7 to 10 days, there hasn't been much need for psychological support for now. Of course, it's important to consider the patient's expectations. If you honestly tell the patients, this is what you can achieve, this is what we can do, and if you don't overpromise, the patient will be satisfied with the results. So doctor, I'm curious. You mentioned you also perform arm lift. Are there other areas of application? So besides arm lift, besides tummy tuck? I mean, wherever there is excess skin on the body, we cut and remove it. Can it be applied to the neck area? Of course, of course. We do it in the form of a facelift. We do it in the form of a facelift. In patients who have undergone weight loss surgery, generally it's needed in the face, neck, eyelids, and also arms, legs. All areas might need procedures.
Coach, there's no chance of recovering these excesses through sports, right?
I mean, if it
the
seriously
ones that
happened, then there's
seriously
already like
require
60
surgery.
to 70 kilograms.
A
It's very
surgical
rare to
procedure
handle
is
it without
definitely
surgical
necessary,
intervention.
right?
I mean, it needs to be lost very slowly with very good exercise. That is also not very possible.
Is there any age limit for this, teacher? I mean, it can be done
More
after a certain age or
important than
before a
the
certain age.
Age limit is the patient's biological age. There is a patient who is 50 years old, but whose body is like 100. There is a patient
We do
who
not
is
accept
70
every
years
patient.
old,
We evaluate
but whose
and
body
decide
is like
accordingly.
40. Pre-surgery anesthesia evaluations
Well,
are conducted.
Is there a big gender difference?
In males, usually only patients who have undergone obesity surgery come. In male patients, fat accumulation is more within the abdomen, around the internal organs, around the intestines, in the area we call mesenteric, which means in a place we cannot intervene with our tummy tuck surgery. So male patients do not benefit much.
Actually, there's something we hear about, sir. I mean, both patients and clients ask, there's something called 360 all around abdomen. And they mention a tightening with a laser treatment
There
following
is a
that.
360 lift, like a 360 liposuction. So in tummy tucks, to slim the waistline and back, it's 360 degrees, meaning the entire
Isn't it what they call
abdomen and back
360
area.
lipo,
The
doctor?
abdomen and back area are treated with liposuction. This 360 liposuction is generally already done by nearly 90% of our doctors in tummy tucks. The 360 lift is generally performed after obesity, gastric bypass and stomach reduction, where patients who have lost a lot of weight experience sagging in what we call the buttocks region. So a full 360-degree skin removal is done to tighten those areas. So the incision for those patients has to be 360 degrees, meaning a full circle incision is necessary.
Well, doctor, can we perform this surgery on young people? You always talk about significant weight
I
gain
said,
after childbirth, but what about ages like 18, 16,
if there is
or
a very
17?
severe deformity, it can be done after the age of 18, if there is a very severe deformity. So if the patient really feels very ugly or feels very bad when undressed, it can be done without waiting for birth. I also have something I'm curious about. When is a tummy tuck done and when is liposuction done? Now, generally, after examining the patient, if the abdominal muscles are firm, if the patient hasn't given birth, or if after childbirth she's worked on her abdominal muscles well, if there is no muscle relaxation, meaning there is no looseness in the muscle we call the rectus abdominis, and if there is no looseness in the skin, liposuction is sufficient for minimal fat in the abdomen and waist areas.
Thank you very much for the information you provided. Bless your mouth.
Thank you very much, teacher. Bless you.
Love and health.